On Wanja's Health Diary today, we have Dr. Michael Gichangi from the Ministry of Health, and he will be telling us more about the human eye. Daktari, karibu sana.
Asante.
What is so special about the human eye? What's different between our eyes and those of animals?
First, I must also say that a human being is different from animals. And so we know the eyes are the windows to many things. The eyes are appropriately positioned to, guide the movement of a person. You see, they are placed on the head, almost at the highest part of a human being, and they are able to identify, forward, backward, above, and then transmit the message to the brain, and then a human being can interpret that. All interpretations, all seeing is actually done in the brain, but the eyes are the ones that capture and then deliver to the brain, and that's needed, that's necessary for survival.
How does the brain interpret messages? Maybe you can take us through, you have an object, you have this. When your eyes look at this, how is this message then translated to the brain and then interpreted that this is a pair of glasses?
So the first thing is that the eyes, I would consider them like a camera. So once they are placed to be able to see an object, the light, I'll use light, goes into the eye, then there is a lot of bending, and then the retina, somewhere behind the eye, will be a center of focus. And then that center of focus stimulates some nerves, which then move to the back of the brain. Now, as you are learning nowadays something called artificial intelligence, what happens is that having seen several things before, it will be interpreted in the brain that an image like this is called spectacles. An image like this is called this. It is used for this. And as one grows, you continue accumulating information, and information that keeps making you understand what is this and what is that. So it is like artificial intelligence now, but now this is intelligence for real. So one image, and that memory is kept. Later on, when you see it again, you'll definitely know that is spectacles, or that is a cap, and so forth. But what it involves is that there is light transmission. It goes through it goes to clear parts of the eye. It is transmitted to the back of the eye. Into the nerves are stimulated, what is frequently or generally known as the optic nerve. It goes to the back of the brain, and from there, that is where there is a lot of nerve interaction, and then it becomes an image.
Okay.
Yeah.
Let's talk about the formation of the eyes in utero, in terms of from the first, second, or the third trimester. At what particular point are the eyes formed? And also looking at the mother who is carrying a child, is there anything specific in their diet that they need to be keen on so that then the child does come out with a good pair of eyes?
I would like to approach it in this way, that from the conception, different organs start forming. And some form from the word go. Literally every organ is forming, but some get completed earlier than the others. Now for the eye, they start forming still in the beginning and continue to develop until birth, and then even continue to develop after birth. And the reason why I'm saying that is that the final development of the potential of the eye to see is usually achieved sometimes after delivery. And this is important because, especially in children, we see that any problem that is occurring in the first few years of life is very important that it is addressed, because the child still has an opportunity up to about age 8, 9, 10 there. The eyes, the potential is still developing. So it is a continuous process from conception, progressively, and it goes even after delivery. There is a situation we call a lazy eye, which occurs when the eye does not develop after delivery. After delivery, what happens is that it needs to continue to be stimulated. The eyes need to continue seeing images and then recording this is this. So if they are not stimulated, then that part of completing the development of sight does not happen, or it develops only up to a certain level. Yeah, so that is, in simple terms, I would want to outline the development of the eyes and the potential to see.
There's a common misconception that children, once they are born, that they're not able to see and that they probably pick up sight in the 3rd, the 4th, or the 5th week. Talk about this common myth.
They are able to see from the word go, but then what is important is that they are able to see up to a certain level, and it is very, very important that they are exposed, or their eye is exposed to stimulation so that it is able to develop. That is what I was saying, that the part of maturation, I would call it maturation of sight, comes after delivery, and it is that maturation that is important for purposes of the completion of the process.
Okay.
Yeah.
How do you stimulate a newborn's eye?
A newborn's gets into an environment, and usually the first contact person is the mother. The face-to-face contact with the mother is one of them, and from time to time the child gets to know how to identify the mother. Frequently in the first times they identify the mother from the scent, from the smell from the mother, and then from time to time, especially when a child is being breastfed, is shown the breast and somehow sees that. Usually they associate that you see this is what you do, and then the child is satisfied. Those are still part of interacting with the environment. When you are showing, or when there is light exposed, darkness, those are still other ways the eyes of a child are stimulated. And eventually they understand that, okay, there is daytime, there is nighttime, and a room can be dark or bright, and that way they are stimulated. When there are small objects around, you eventually come to realize that they reach out for them, and that is an indicator that the sight is developing, something like that. The other aspect of development of the eye structurally, anatomically, is also important, because the eye is embedded in a child's face and everybody's face, and growth is expanding in size, and development is in complexity. Now, growing in size is also very, very important for the child's facial development, because they are supposed to be appropriately placed onto the child. And occasionally you will note that if a child does not have an eyeball on one side, there may be facial symmetry, that side of the face may fail to develop normally.
Okay.
Yeah, so we look at it both anatomically or structurally, and also functionally.
Still in the topic of the growth and development of the eye, what are some of those early eye conditions that are common in newborns?
Some of the eye conditions that are common in newborn that interfere with development or maybe interfere with maturation of the eyes. One, congenital abnormalities in development, I would call that in general. Commonly, you can also get congenital cataract, which children are born with, either because the mother had problems when she was pregnant or got some infections while pregnant and so forth. Others, you might see some children with, again, a big eyes, something we call ophthalmos, or an eye similar to that of a bull. It is milky and looks beautiful, apparently, but it is a sign of an underlying condition. So the most important thing, there are many of those. The most important thing, especially for one to observe, you want to know whether there is something out of normal, is generally the parts of the eye. The black part is black, the white part is white. You know, there is nothing different from what is. You know, the eyeballs are opening, the eyelids are opening spontaneously and so forth. Usually when that is not happening, or you see something, the color is a bit different, then there's something wrong. And usually the best thing is to have such a child attended to as soon as possible. Yeah. Usually in my training as a medical doctor, I may not have gone into the fine details of the eye and may not know, but now as an ophthalmologist, I understand much more details, and from the general public or health to the general health workers, the most important thing is to note that the white part is white, the black is black, and it is round. You know, there's nothing unusual. When you see something unusual, it is a signal that such a child needs to be evaluated by an ophthalmologist or a pediatric ophthalmologist to be able to identify exactly where the problem is. Okay. But commonly, congenital cataract exists, ophthalmos exist, and so forth.